name is Hitomi Iwasaki. I'm a student at the University of Cincinnati College of Pharmacy. Today I will be presenting on the COVID-19 vaccine rollout process. Objectives today are to look at the COVID vaccine rollout process itself, the phases of vaccine distribution and where to look to stay up to date on this process, and any resources that are available for patients and where to make an appointment. So, how did the COVID-19 vaccines become available so quickly? So, next we will go to development and authorization. So the coronaviruses have already sort of been researched prior to COVID-19. We've already seen SARS-CoV, which is SARS, and then MERS-CoV, which is MERS. Through the knowledge of these two viruses prior, we sort of had an idea of how to go about creating a vaccine for the SARS-CoV-2 itself. The day prior sort of talked about the vaccine itself and how it was created. So next we will talk about the Food and Drug Administration, aka the FDA, reviews and evaluates vaccinations for your quality, safety, and effectiveness. The COVID-19 vaccine was authorized under an emergency use authorization, which is defined as a mechanism to facilitate the availability and use of medical countermeasures, including vaccines, during public health emergencies. COVID-19 is a public health emergency, as we've seen over the past year and a half. The CDC and Prevention Advisory Committee on Immunization Practices has provided guidance on the use of the vaccine and the distribution. How is ODH, the Ohio Department of Health, prioritizing who receives the vaccine? This is based on our age, our risk, and our occupation. We will see this throughout the phases of the vaccine distribution. So, what are the phases? Phase 1A will include those below who choose to be vaccinated. These include healthcare workers, residents and staff in nursing homes, residents and staff in assisted living facilities, patients and staff at state psychiatric hospitals, people with developmental disabilities, and those with mental health disorders, included are listed below, residents and staff at our 2 state-run homes for Ohio veterans, and as well as EMS responders, our police officers, emergency medical services, fire department, anything like that. Phase 1B includes all Ohioans age 65 and up, as well as Ohioans born who have early childhood conditions that are carried into adulthood, which put them at a higher risk for contracting COVID-19 and having severe outcomes, as well as any adults, employees in K through 12 schools that would like to go back or to remain educating in person, as well as anyone included in 1B. Phase 1C includes individuals who have additional medical conditions that may increase their risk of severe illness or death from COVID-19, Ohioans who work in certain occupations, including child care services, funeral services, and law enforcement and correctional services. 1D includes individuals who have specified medical conditions that may increase their risk of severe illness and death from COVID-19. These include different conditions that were not included prior. Phase 2A includes individuals 60 and older. Phase 2B also includes individuals age 50 and older, as well as anyone age 60 and older who were previously eligible. Phase 2C includes those who are 40 or older, as well as anyone priorly listed in Phase 1B or Phase 2B. Phase 2D includes individuals who are 16 and older, as well as anyone from Phase 1B, 2A, 2B, or Phase 2C. Currently, vaccinations are available for children and teens who are 12 and older. They are only eligible for the Pfizer vaccine. You can stay up to date on these phases at coronavirus.ohio.gov. So how do I sign up to receive a COVID-19 vaccine? Step 1, go to gettheshot.coronavirus.ohio.gov. Step 2, you can choose your language, and then you press check eligibility and book my appointment. Step 3, you will choose if you're filling out this form on behalf of someone else, yes or no. If you select yes, it'll have a drop-down screen that'll have additional information to fill out. Is the vaccine recipient age 12 or older? You will select yes or no, and then 12 through 17 are only eligible for Pfizer as well. Step 3 continued, you will go through a list of agreements and acknowledgements, and then after that you will press continue. So step 4 is it'll tell you yes or no that you're eligible. If you are eligible, you will see this screen, and then you will fill out your zip code and try to find the closest vaccine clinic to you. Step 5 will be selecting your location. It'll list all of the clinics that are closest to you that you could choose from. So after you choose a location, it'll show up with the earliest appointment available, and from there you can click your calendar. You can go July, August, September, October, etc. And then you will select a time. After you've selected your time and date, you will go into your contact information, and you will fill out your name, middle name optional, last name, birth date, sex, male, female, non-binary, prefer not to say, email, mobile is optional, street address, city, state, zip code, race, ethnicity. Do you have a disability? Yes or no, prefer not to say. Do you have limited mobility? Yes, no, prefer not to say. And then your weight is also optional if you do not want to list that. Step 8 will be medical insurance questions. If you have medical insurance, you can select yes, and then you will fill out, if you do have insurance, you will be asked to fill out the following on the right side of the screen: your primary carrier, vaccine recipient, is the vaccine recipient the primary policyholder? Yes or no. Group number, member ID. Those can all be found on your insurance card yourself. If you do not have a copy of that, contact your insurance provider. I'm sure they would be happy to get that information for you. If you do not, you just select no and continue on. This is at a no cost to you, so if you select no, you still be eligible to receive the vaccine. Step 9, you will receive a confirmation code to the email that you provided previously when you filled out your contact information. It may take a few minutes to arrive, so sit tight. If not, check your junk email, and you can also resend a code if you do not receive it at all. Step 10, show up to your appointment. I know Uber for sure has options to select vaccine clinic, and then they will take you to and from your destination for free, as long as you are receiving that COVID-19 vaccine. I'm sure other driving services are also available to do that as well, but I know Uber for sure has that available. I use the FDA, and I use the COVID-19 vaccination dashboard provided by the Ohio government. Thank you. Have a great day.